Hello, I'm Dr. Annalene Weston, Dentolegal consultant at Dental Protection. Welcome to RiskBites, a series of podcasts created specifically for dental practitioners in Australia. RiskBites looks at the key dental legal risks and issues affecting dental practitioners across Australia and provides helpful advice and guidance on how to steer clear of them, leaving you free to provide safe and high-quality dental care for your patients. Today, I'm going to be chatting with my colleague, Dr. Kiran Keshwara, about aesthetic dentistry and the potential pitfalls that we may encounter. Now, aesthetic or cosmetic dentistry is an area where we are definitely receiving an uptick in phone calls from members, usually because a patient's unhappy with the treatment outcome. So to start off with then, Kiran, can you give us an overview on some of the popular aesthetic treatments that patients request and why this field of dentistry has grown so rapidly recently?
Sure. Patients today are much more focused on their dental appearance and smile than I think they have ever been in the past. Common requests you may get are for teeth whitening, porcelain veneers, ortho, Invisalign, maybe all of the above. Patients want brighter, straighter, more youthful smiles, and I think social media has definitely increased awareness of cosmetic dentistry options. The technology available now also allows us to achieve really beautiful, natural-looking results that probably weren't possible 20 years ago. While aesthetic dentistry is an exciting area of dentistry, it also has some major complications that we need to consider.
Yeah, and as we all know, it's so rewarding to transform someone's smile and boost their confidence, and it can be life-changing for the patient. But there are risks involved in this type of dentistry dental practitioners should be mindful of. So can you run us through those, please, Kiran?
Yeah, there are indeed risks, Annalene. And while helping patients improve their appearance is gratifying, it's important that the practitioners are aware that aesthetic dentistry has higher risks than routine dental care. I think the overarching risk that could be considered a catch-all for all the complaints and woes that we see result from mismatched expectations between practitioner and patient. Patients may not communicate their goals clearly or have unrealistic expectations of what we can achieve. Sometimes, unfortunately, a patient doesn't really know what they want themselves and so are unable to articulate that to you. Some patients, as I'm sure we've all seen, will think that having an improved smile will magically make all their other problems in their life disappear.
And as we know, it doesn't.
It doesn't.
So what steps can we take early on to understand the patient's objectives so we can align on a treatment plan?
I think good planning is critical. And we can often get caught up in focusing on the clinical side of the provision of dentistry, such as taking x-rays and study models, which are, as always, a very important part of gathering information, aiding with diagnosis and treatment planning. However, there are a number of non-clinical steps that you should take to ensure that you're able to provide the patient with their desired outcome and to make sure you can sleep peacefully at night. I think the consultation itself is the key. You should have an in-depth discussion of the patient's concerns and what they want to improve. Ask plenty of questions to understand exactly what they're hoping to achieve and why they want to undergo potentially expensive and irreversible cosmetic treatment on their teeth. Take the time to listen and ask patients to show you photos of smiles they like. Do wax-ups and digital smile simulations. Give both a visualization of potential outcomes and can also highlight potential issues with the occlusion, for example. It may also be useful to involve family members or close friends if the patient wants external input. And as you know, Annalene, documenting all of this in the records is crucial.
Absolutely. And I think all of that's really relevant, Kiran. But I particularly liked your inclusion of having the external input because I know I've had a couple of cases recently where the patient's been really happy and then they've gone home and a well-meaning partner or friend has made some comments and it's just shattered their confidence. And at that moment, there's no coming back from that.
Yeah, especially if those, veneers or crowns have been cemented in permanently, then it's difficult to go back.
It is. So communication and documentation are critically important to avoid problems down the line. So what about when we're talking about our consent process?
As you know, Annalene, consent is more than having the patient sign a piece of paper. Your consent process should start with explaining all the patient options, including the option of no treatment and the option of referral to an appropriate specialist. Discuss the pros and cons of each choice, including aspects such as costs, timeframes, and risks such as devitalization, tooth sensitivity, and the need for replacement in the future. Patients need to know elective aesthetic dentistry has limitations and that their lifestyle will impact the longevity. You should also give a breakdown of the costs, not just a total fee. Before you put drill to tooth, always confirm that the patient wants to go ahead with the treatment and highlight to them that the treatment you're providing is irreversible. Again, detailed records of your discussions form the basis of your informed consent.
Yeah, they do. And I think setting aligned expectations also seems to be key, don't you think, Kiran? So the patient understands the limitations of their care and what they're going to end up with. What's a good approach to achieve this, Kiran?
I think a good adage in any treatment involving elective or aesthetic dentistry is under-promise and over-deliver. Patients need realistic expectations of what we can achieve and how long it will last. Some only want a quick fix for an event such as a wedding. I personally, when I'm seeing patients, explain to them that things like whitening is a short-term fix and will need topping up, and veneers and crowns need regular maintenance and possibly replacement in 5 to 10 years. Patients need to know that elective dentistry has limitations. You should also set financial expectations by confirming that they can confirm the treatment plan. Take time to set expectations upfront to ensure that there are hopefully fewer complications later on.
Yeah, and one of the questions we're always asked, what do you do if a patient wants a treatment that you don't recommend or that you can't provide?
I think we've spoken about this in one of our previous podcasts as well. And it's important not to let patients push you into treatment that you're not comfortable with. Some patients will have unrealistic expectations of what we can do. So you should be honest with them. If you think a case is beyond your expertise, refer to a prosthodontist or other relevant specialist. Will always benefit the patient. There will always be some patients you simply cannot satisfy no matter what you do. Declining treatment preserves your ethics and avoids problems.
And despite our best efforts, there are times where the patients are still unhappy with aesthetic treatment results. Now, naturally, this is the side of aesthetic dentistry that we at Dental Protection are most familiar with, because practitioners rarely call us to tell us that everything's going swimmingly well. So do you have any broad brush advice on how to handle these aesthetic complaints?
Sure. It's a regrettable fact that complaints will happen even when you've taken all the right precautions. How you respond to your patient is very important. Listen calmly to your patient's concerns and document details in the patient's notes. Taking clinical photos helps as well. You should explain options like adjusting treatment at no cost or redoing portions of the work. Ideally, your aim is to find a reasonable solution and maintain trust. A professional approach prevents issues from escalating, and if you feel that a situation is escalating or becoming too complicated, remember you should always call us to discuss the best options moving forwards.
Are there any other thoughts you'd like to share on providing aesthetic dentistry safely, Kiran?
Yeah, a few final tips. Don't rush treatment plans just to please your patients. Take the time to plan and set expectations. Educate your patients that aesthetic dentistry has limitations and record every detail to demonstrate that you meet the standard of care. I think it's important also to stay current on techniques and materials by continuing education. And finally, never be afraid to say no or refer out complex cases. I think following these principles help make aesthetic dentistry rewarding for both patient and for the dentist.
Wise words indeed, Kiran. Thank you. And thank you all for joining us today. And we hope that you found this content relevant and helpful. And we look forward to sharing more guidance with you in the future. If you like Dental Protection podcasts and you'd like to hear more, please subscribe and leave a review.